A recorded version a recorded version of the webinar is available, which is being streamlined live on YouTube. And please do share with friends, family, and colleagues. Kindly fill in the form at the link given in the chat box for the participation certificates. I now request Dr. Sujata. I now request Dr. Sujata, who is a family physician and the Associate Medical Director at Unicorpus YMCA unit, to lead us in the opening prayer.
Pray. Good evening, everybody. This is my privilege to join you today evening. We will pray. Our loving and living Heavenly Father, thank you for giving us this opportunity to gather for this webinar and to know more about this World Health Day. Thank you, Lord, for blessing Unicorpus in sharing knowledge, encouraging and empowering medical people. Please be with us in this webinar today. Bless all the participants and speakers. Be with us. Let there be no disturbance of any sort, Lord. Let the power be there. Let weather disturbances, there should not be any disturbance of any sort. Please help us to have good understanding and let this webinar be an instrument to glorify your name. In Jesus' name I pray.
Amen.
Amen.
I now request Mrs. Kavita David, who is a Chief Operating Officer at Unicorpus, to give a brief introduction to the work being done at Unicorpus Health Foundation.
Good evening, everyone. It's my privilege to share with you about the work of Unicorpus Health Foundation. Just give me a minute to share my screen. Thank you all once again for joining us today as we celebrate World Health Day. To give you in a nutshell about Unicorpus Health Foundation, Unicorpus Health Foundation is a not-for-profit Section 8 company registered under Companies Act. We are a 12A ATG approved organization, and our journey of Unicorpus starts way back in November 2015. And after we registered as a Section 8 company, we did a couple of health camps, and also we did some ground level studies with the students of Michigan and other local bodies. And we felt that there was a great need for geriatric care. And therefore, we started our first polyclinic in 2016 November, which is Unicorpus Senior Citizens Polyclinic. And our vision is to come together as one body, Unicorpus, to use our diverse gifts to elevate the suffering of the sick and the afflicted. We want to provide affordable, ethical, approachable, compassionate, and holistic health services to our urban and rural population through consultations, medical and dental, physiotherapy, home care, palliative care, and inpatient services. These are our values: faith, compassion, servant leadership, teamwork, pursuit of excellence, innovation, integrity, and sustainability. Our motto and caption is to each one for benefit of all, and know and own your health. As I take you through our journey, you'll be able to understand how we are working on our motto and caption as well. And in fact, the webinar which you're doing is part of our Know and Own Your Health series. So synopsis of our work, we have a clinic, a polyclinic, which is a polyclinic, senior citizens clinic, multi-speciality dental clinic located at Secunderabad, where we have registered more than 8,600 plus unique patients and done close to 18,000 plus consultations. And also we provide physiotherapy, counseling, and palliative care. We are also running specialty clinics like spine and diabetic clinic. We have a 30-bedded hospital at Word Indeed India campus, which is called Unicorvus Word Indeed Hospital, where we are providing inpatient, outpatient surgical rehabilitation and trauma. We are regularly conducting multi-specialty health camps. We have done over 40 health camps with over 2,300 plus consultations. And even in the health camps, we have specialty health camps called as Peribitin, which is focused at Fruit of the Womb. And in Know and Own Your Health, we release a lot of patient education material, both print and video. And we have released 16 issues of Unicorpus Geriatric newsletter. If any one of you would like to write an article, please revert to us. We are doing health talks. We are conducting a specialized program on health safety, and we are doing a lot of CMEs, online CMEs, webinars, etc. These are just glimpses of our clinic. This was our old premises. And now we have moved to a new premises, which is at YMCA Secunderabad, which is a bigger facility, and it is also much accessible to many people. So this is the glimpse of our new facility. And we have a multi-speciality dental clinic, and we have improved our dental setup, especially to make it safe for both doctors and patients. And we have put in specialized equipment, which includes power aid, respirator, high suction, fogger, HEPA filters to make it safe for both patients and doctors. This is some of the glimpses of our health camps, which we continuously do. This month we have just suspended them because of COVID, but otherwise we keep doing health camps almost every month, at least 3 to 4 of them. This is a special format clinic which we have started called a spine clinic, which we have been doing for the last 2 years, wherein there is a comprehensive evaluation by a spine surgeon, orthosurgeon, and a physiotherapist, so that the patient can be given comprehensive diagnosis and treatment. And the same format with diabetic clinic, in both these formats, we also have education program to the patient so that they know how to take care of the complications which come out of the spine problems or diabetic problems, etc. And these are some of the health talks. This is a health talk on helmet awareness, which we have done at Aga Khan Academy. And this is a health talk done at Invesco. We are also doing online health talks for many corporates who are asking us. The glimpses of the newsletter that we are publishing. Know and Own Your Health, which is patient education material. We release a calendar every year called as Unicorpus Health Tips Calendar. This year we have also released this in Telugu. We have been doing this for the past 4 years. Some of our patient education material, and also this was the COVID talk about COVID, which was telecast in one of the TV channels. This is a glimpse of our Word Indeed hospital. Here we have a 30-bed facility with 24/7 emergency services, X-ray lab, well equipment, operation theater with CIAM. We have a semi-ICU with ventilator, defib, CPAP, BiPAP, oxygen concentrator, and infusion pump. The surgical departments are general surgery, obstetrics, and gynecology, urology, orthopedics, spine, pediatrics, peripheral nerve, endocrinology, and trauma. And in just less than 12 months of our operation, we have done more than 70 plus surgeries. And we are also part of the government programs, which is like Pulse Polio. This is endoscopy in progress. Some of the glimpses of our surgeries: this is general surgery, OG, laparoscopic, orthoscopy, urology, pediatric surgery. I would just like to take a pause and talk about the surgery. This is a child which had come from a very poor village. You can see his house on the left hand side of the picture. So we actually raised donation, and we did surgery for this child, and the child is doing really well, which you can see on the other side of the slide. This is also another rare case called a bladder extrophy, which was performed in our hospital by a senior surgeon, Dr. Jacob Chaco from CMC. The child was with us for a month. The child is stable and the child is doing well. And this is a recent peripheral nerve surgery, surgical endocrinology. Not only our surgical services, at the beginning of COVID last year, we had started a Unicorpus online consultation for COVID-19 patients under home isolation. We treated over 300 patients, and we are now we are continuing that program, and we are going to launch a new program soon for patients under home isolation. We are also doing teleconsultation, and we use online platforms to help learning both internal and external. So these are some of our telemedicine initiatives. May I request the participants to please mute yourselves. So some of our plans in the pipeline are we want to start Unicorpus clinical home care services. We are doing home care services, but on the telemedicine mode, and we would like to have a place where our teams can visit them in their homes. Unicorpus Hospital, Unicorpus Ophthalmology Unit, Unicorpus Infectious Diseases Unit, Pharmacy Rehab Unit, Palliative Care Unit, and our big dream is to have a Unicorpus University soon. Though we are in the first step, we are dreaming big, and we believe that God is going to make it happen for us. This is some glimpses of our team, and the journey has been great, and we believe that there is much more to do, and we would invite all of you to join us in this journey of providing ethical, affordable, compassionate, holistic services. And if you'd like to know more about us, you can drop in a line to any one of us or talk to us. Thank you for this time, and now I hand it over to Dr. Jyotsna, please.
Thank you, Mrs. Kavita, for the introduction. World Health Day. World Health Day was first instituted in the year 1948 by WHO, which held the first World Assembly which held the first health assembly. The assembly decided to celebrate 7th April of each year with the effect from 1950 as World Health Day. It is held as a mark. It is held to mark the WHO's founding. It is seen as an opportunity by the organization to draw worldwide attention to a subject of major importance to global health each year. World Health Day 2021. The theme for this year is Building a Fairer and a Healthier World. It marks health equity, a starting point for a year-long equity campaign by WHO. COVID-19 has illuminated and magnified health inequities and the inequalities are predicted to increase in the near future. COVID-19, as we see, some have better access to health services than the others. Entirely due to the conditions into which they are born, grow, live, work, and age. All over the world, some groups struggle to make ends meet with little daily income, having poorer housing conditions and education, fewer employment opportunities, experience greater gender inequality, and have little or no access to safe environments such as clean water, air, food security, and health services. COVID-19 has hit all countries hard, but its impact has been the hardest in the low socioeconomic groups. So WHO calls on all the leaders to work hand in hand with the affected communities and individuals to address root causes of inequities and to implement solutions, and also to collect reliable data by gender, income, age, education, migratory status, disability, and geographic locations to assess inequities. And to increase investment in public primary health care to ensure health for all. and also to act beyond borders. It also, World Health Organization also believes that everyone should have the services and the information they need to take care of their health and the health of their families. This is very much in tune with what our motto is, which is to know and own your health. So in line with this motto, we welcome you to today's webinar on World Health Day. As for those of you who are joining us now, we welcome you, and we request all the participants to post all your questions in the chat box, and also for participation certificates, kindly fill in the form at the link given in the chat box. And this webinar is being streamlined. Kindly share with friends and family. We are privileged to have Dr. A. Lakshmaya, who is a director grade scientist and the head of the division of the Public Health Nutrition at the renowned ICMR National Institute of Nutrition, Hyderabad, to give us the first keynote address on nutrition and health. Dr. Lakshmaya has done MBBS and Masters in Public Health and PhD in Public Health Nutrition. At ICMR, he has conducted many training and capacity building programs for health and nutrition functionaries at various states, carried out more than 50 large-scale epidemiological studies, translational research, impact evaluations, and randomized clinical trials in the field of nutrition and health. He has more than 28 years of experience at the ICMR National Institute of Nutrition in Hyderabad in various positions. He is also the National Secretary at the Nutrition Society of India. He is a subject expert in the public health nutrition in several central and state ministries such as Health and Family Welfare, Women and Child Development, DST, DBT, and the ICMR and HRD. He has also published more than 150 papers in national and international peer-reviewed journals. He has received several awards and honors. Some of them are international. He has been awarded the International Health Professional of the Year 2010 by the Research and Advisory Board, International Biographical Centre, Cambridge University, UK. A postdoctoral fellowship award from Bristol University, London School of Hygiene and Tropical Medicine. He is an honorary research fellow in the Faculty of Medicine, Imperial College London. So, thank you. Thank you very much for accepting our invitation. We are privileged to have you with us. Sir, over to you.
Good evening, everyone. Thank you, Jyotsna, for your kind words. And I'm very happy to participate in this. I'm very thankful for giving this opportunity. I'm also thank you for Unicorpus Health Foundation for giving this opportunity. So just a minute, I will share my slides.
Sure, sir.
Is it visible, my slides?
Yes, sir.
Okay, today, so I'm speaking briefly on health and nutrition, but this subject, everyone aware of health and nutrition, but just I'm putting all the things in one place. So here, first, my slide is the relationship between health and nutrition. So actually, we used to say without nutrition, there is no health. And even without health also, there is no nutrition, because absorption will not happen any intake of food. So good nutrition is the key to leading a healthy lifestyle. Eating a balanced diet is an important part of good health. Nutrition plays a major role in promoting good health. So diets full of fruits, vegetables, whole grains, nuts, lean meats have proven health benefits like lowering blood pressure, improving glucose control in diabetes and weight loss, improving arthritis, and reducing some of the cancers, especially gastrointestinal cancer and cardiovascular events. So there is a relation, infection and malnutrition. It's a vicious cycle, and we cannot, because this cycle goes on. Infection leads to nutrition or undernutrition. Undernutrition leads to again infection. We have to break this cycle. Without breaking this cycle, it is it is going to be unhealthy condition. So some of the this slide shows that the major cause of death among children under 5 years globally. You can see the nutrition plays a major role, and directly, indirectly, 60% of under 5 child deaths is because of undernutrition. So that reveals what is the importance of nutrition, and also what are the significance of nutrition. So nutrition helps normal growth, development, and various physiological functions. Epidemiological data reveals strong association between undernutrition and morbidity, mortality, and we can see some of the poor countries like some South African countries. So the undernutrition is very high. And chronic degenerative disorders such as coronary heart disease, hypertension, type 2 diabetes, certain types of cancers also related to diet and nutrition status. Consumption of foods rich in dietary fiber, antioxidants associated with reduced risk of certain types of cancer. And obesity, overweight is also associated with the increased risk of developing cancer in the breast, colon, endometrium, gallbladder, esophagus, pancreas, and kidney. Undernutrition in early childhood is associated with early onset of non-communicable disease in the later life. That is the David Barker's hypothesis. Is a Britain nutrition scientist. And this is the evidence for the fetal origins of adult chronic diseases. As per Barker's hypothesis, if child born with intrauterine growth retardation with significant nutrition itself, the child grown up and become an adult, so the early onset of this chronic degenerative diseases is happen. Now we are seeing most of the cases 25 years, 30 years only, heart attack and other problems. And the pathophysiology, you can see the IUGR leads to insulin resistant genotype, insulin resistance, and then insulin resistant phenotype also leads to insulin resistance and diabetic mellitus and fatty liver diseases, hypertension, and dyslipidemia. So what is health? So I need not define health, but as per WHO, everybody aware that the health is a state of complete physical, mental, social well-being, but not only just absence of disease or infirmity. And so what is nutrition? Nutrition is the process of taking a food into the body and absorbing the nutrients into those foods. And what is malnutrition? Usually malnutrition means we understood that most of people undernutrition, but not only undernutrition, malnutrition also tells included the overnutrition and the undernutrition. And who are the people generally affected with undernutrition? And the infants and young children, adolescent girls, pregnant and lactating women, elderly people, and socioeconomically deprived groups. And these are the main groups, the vulnerable groups, we can say. So what are the determinants of nutritional status? It is a very multifactorial involvement is there. You can see agroclimatic factors, the production and all those things happen. And population, family size, then religion, community, occupation, drugs, and availability of participation in developmental programs, physiological factor, pregnancy, lactation. Ultimately, all this leads to food intake and nutritional status, of course, environmental factor, pathophysiological factor, infections and infestations. These are all, you all may be aware of all these factors, but to control undernutrition, we have to address all these factors. So what are the national nutrition challenges? You may be aware of that, and we are facing triple burden of disease, protein energy malnutrition, micronutrient deficiencies like vitamin A, iron deficiency, zinc deficiency, and recently in some of the places, some states, we also noticed that thiamine deficiency, especially Delhi, Assam, and other northeastern states, it is occurring. And then third one is diet-related chronic diseases. These are all battery of non-communicable diseases we are experiencing in India in epidemic proportions. If you see the global status of nutrition challenges, you can see 2 billion people are suffering from one or the other micronutrient deficiencies, and 155 million children are stunted. Out of the 155 million children, around 46 to 50 million children are contributing by India itself, and 52 million children are wasted. 2 billion people are overweight or obese. 41 million children are overweight, and 88% of countries are facing one or the other kind of the challenges. So if you take in India, the stunting in children under 5 years is 46 millions, and 72 million people are suffering from diabetes, and 166 million people are suffering from overweight, obesity, and 447 million people are suffering from micronutrient deficiencies like anemia. So why we are discussing this? These are all food related diseases, morbidities, you can see, and then the ugly face of hidden hunger, the micronutrient deficiencies, the iron deficiency, folic acid deficiency leads to neural tube defect and vitamin A deficiency. So nutritional blindness and iodine deficiency and zinc deficiency and growth retardation and other things. So then B12 deficiency is also very high nowadays, and we have carried out recently in 10 states, entire India, and we found that the B12 deficiency is also very high, around 25% of B12 deficiency. We have done this study recently in all the 3 groups, adolescents, young adults, and geriatric population. So we are facing double burden of disease in the same community. We can see both kind of pictures. We can see. So we have to address immediately these issues, and the stunting declined among children under 5 years. The NFHS and NFHS core and CNNS survey recently carried out the comprehensive national nutrition survey carried out recently 2016 and 17, and we are also one of the partner in this survey. So the ancient Greece, Hippocrates, father of medicine, 400 BC, wrote that let the food be the medicine and thy medicine be thy food. So he is emphasizing that the role of the food. So the food can be taken as a medicine. Otherwise, medicine has to be taken as a food. So even in old age people, we are observing, because they are consuming some almost 15 to 20 medicines in the morning. So these kind of issues will be there. And another point also, this is also a very important proverb. You can see, regardless of who the father of a disease is, surely its mother is improper diet. So this also shows what is the importance of the diet for healthy people. And recently we are also speaking about Asian Indians. Asian Indians, even some of the papers also published recently. The Asian genes are very bad genes, and they are loaded guns. Asian genes are loaded guns. The trigger is your bad lifestyle. So this is also very important. And eat for your DNA. This is a very, very well said slogan. Every individual is genetically different, and the diet should be customized for your genetic type. So the blanket type of advertisement, blanket type of promotion of food is not working out. So we have to specifically work out food for each subject. So before I start what is the food intake and other thing, the NNMB surveys estimated consumption levels of sugar, salt, and fats in the state of all these 10 states, and in urban area 16 states we have conducted. So the National Nutrition Monitoring Bureau, I am the director of this National Nutrition Monitoring Bureau. This is situated in 6 states in India. So the objective of this monitoring bureau is to collect diet and nutrition status periodically among rural, urban, and tribal population. So some of the findings you can see in this average food intake per CU per day as percent of RDA. Over a period of time, the cereal intake is reducing, the pulses intake is almost same, the GLV is increasing, and other vegetables is more or less same. And roots and tubers, we are meeting the RDA, but you can milk and milk product consumption is very less, even though we are number 1 in production in milk and milk products. And fats and oils also increasing slowly, and sugar and jaggery is not a problem in India. especially in rural areas. If you come to the nutrients, you can see protein is consumption is reducing, and energy is reducing, and calcium is meeting, and iron also we are meeting this thing. Vachesna ikkada. So then and this is also you can the important findings we have observed by analyzing the NNMB diet and nutrition data. So you can see in all the states, the consumption of visible fats, it is increasing like anything. You can see Kerala, Tamil Nadu, almost all the states, it is increasing like a step ladder pattern. So this is actually the fat content of the fat in the body is the crucial risk factor. You are all well aware of that. And what are the determinants of these NCDs? So common risk factors and intermediate risk factor and NCD disease outcomes you can see. So these are modifiable and non-modifiable factors. And modifiable factors we can correct and through our lifestyles. So here, if you are unable to correct here, at least we can control the intermediate risk factor, and you can prevent the disease patterns. So we are also calling this lifestyle factors affecting lifestyle. These are very, very important, and the NCDs otherwise called also it is a lifestyle diseases. So the way we are born, the way we grow up, the food what we eat, the fluids what we drink, the way we live, the way we play, the way we move, the work we do, the social habits, the way we conduct our personal lives. These are all influence our lifestyles, and if our lifestyles are adopting healthy lifestyles, so ultimately we can reach our healthy goal. So this is also you can see the non-communicable disease over a period of time, it is increasing like anything. That's why we are facing epidemic of non-communicable diseases. And what are the root causes? The physical inactivity, unhealthy diets, and smoking. These are the three primary causes or root causes. The fruits what we are getting, the diabetes and heart attack and heart diseases, cancer, chronic lung diseases, and other NCDs. And this is also now the recently Lancet publication, you can see that globally 6 out of 9 risk factors driving the global burden of disease are related to nutrition and diet only. All the green ones you can see, these are all diet related chronic diseases. And if you control diet or if you eat a healthy diet, we can control most of this GBD diseases, global burden of diseases we can control. And this is also very important. You can see the shape of things to come. So the evolution is desired, but we are going back to, so we are not going back to monkey to man, and we are also going to obesity. So this we have to stop here. And if you see the adult obesity globally, you can see the global epidemic. I already said global epidemic. We are facing global epidemic. And these are the different definitions, Asian Indians for BMI, and these are global cutoffs. If you see these cutoffs levels, you can see 1.7 billion if Asian cutoff is used. So these are all the magnitude of the problem it reveals. And recently we have carried out this among adolescents. You can see prevalence of overweight obesity among adolescents 10 to 19 years by state. This is CNNS Comprehensive National Nutrition Survey. In almost all the states we have carried out this study, and you can see the prevalence of overweight obesity among adolescents is very, very high. Some of the states like even Andhra Pradesh, Kerala, Arunachal Pradesh, Delhi, Goa, and Tamil Nadu. And this prevalence of overweight obesity among children in various studies you can see. So even myself, I have carried out 4 studies in Andhra Pradesh and Telangana and these southern regions. So the prevalence of overweight obesity among childhood, it is the prevalence is around 10% to 30% children are suffering from overweight obesity, and it is increasing over a period of time. This is in Hyderabad. We have carried out 2004, 2007, 2014, 2012. You can see the time trends of overweight obesity. And this is prevalence of overweight, obesity, hypertension, diabetes mellitus among rural population. NNMB surveys, we can see overweight, obesity, men and women, hypertension. This is in a rural population. You can see hypertension. Every fourth person is suffering from hypertension, even in rural area. So this is a very surprising finding. And diabetes, around less than 10% people are suffering from diabetes. You can say why the overweight obesity is increasing. Role in marketing of food and beverages for children. So these are the usual things you can see. And another thing is obesogenic schools and tuition classes makes inactive environment. The obesogenic environment, we are creating obesogenic environment among children, because the child go to school and he has come to home also relaxing, and otherwise he has to attend tuition again, then come to home and relax in front of TV or computer games or mobile phones and other things. So even the school teachers, parents, everybody is aimed to get their child to first mark or good marks. So that is the main thing. The physical activity. So physical education at schools is almost nil, most of the schools. And this is the picture you can see. Even though playground is available, even though play material is available, the children will not be seen in these areas. And we have also analyzed and published this principal component analysis. You can see the diet, what is the role of diet in leading to obesity, overweight among children. Almost 53% of contribution is only diet, bad diet, and the fatty diet and intake of processed foods and other things. So why should we worried about this childhood obesity? You can see the childhood obesity, the one important point is 77% of overweight obesity carried over to adulthood from childhood. So that is the major danger. So to control overweight obesity is very, very important during the childhood. So we as a parents like to give our children many things, but let obesity is not be one of them, because the parental attitude, parental behavior also lead to the overweight obesity among the children. So recently we have published the time trends in adult body mass index in 200 countries from pooled analysis in the Lancet. So this paper also describes what is the time trends and what are the risk factors about body mass index increase and this thing. And this graph also clearly shows that it is a J-shaped curve. Even your BMI is less also, there is a risk. And if it is more also, there is a risk. Cardiovascular risk mortality is clearly shown in this graph. So we have to maintain our BMI should be less than 18 point, more than 18.52 and less than 25 of BMI. And this is also very true. Abdominal obesity, wherever you go, in markets and wherever you go, everyone is with a belly, small belly or big, just like a pregnancy. You can see central obesity, insulin resistance, the South Asian susceptibility. Why we are calling South Asian susceptibility? The South Asian population genes are made so that the affinity of fat is very high in the South Asian population. You can see this graph also clearly shows that if increasing the waist hip ratio, the South Asian susceptibility of the diabetic mellitus is a straight line. You can see in the same case, European is also increasing, but not that straight. You can see not that fast. And these are the risk factors. You can see odds ratios of 95% confidence interval diabetes with waist circumference, WHR, and BMI is clearly shows that. So the number of times risk increased with increase of waist circumference and these nutritional parameters. And whole body fat also very important. And we have also measured whole body fat, more than 45,000 population in India. And that also shows that this 3.1, and especially in women, it is 7 times higher risk of getting NCDs if the if the whole body fat percentage is high, more than 30% in case of female, and it should be less than 25% is in male. And these are the consequences of overweight, obesity, and diabetes, stroke, heart disease, hypertension, gallbladder disease, osteoarthritis, sleep apnea, cancers. So don't try to give shelter under your belly. So this is the main message. And if you discuss about the diabetes, so the diabetes, the global scenario is very alarming. You can see global scenario is very high. Almost 380 million world people are suffering from overweight, diabetes. And you can see here the China and India. Now this is almost a very old one, but now recent statistics shows that even India is beating China for towards gold medal in getting this diabetes. Okay, so this worldwide trends in diabetes. This paper was also published recently. It is a pooled analysis of 4.4 million participants in this. I'm also one of the author in this. So the prevalence of pre-diabetic status among adolescents, this is also seen in a survey, shows that. So in this school age and adolescent age groups, the pre-diabetic status is also very high in India. Some of the states are very alarming. So I am not going every state-wise description because the time is very short, and I will leave the slides, and if anybody interested also, they can go through these slides. And the prevalence of diabetes among rural women and rural men, you can see the 8%, this is already there, but different states, it is varies from state to state. Some of the states is very high, even hypertension, diabetes, and all non-communicable diseases are very high in Kerala. And some of the states like Madhya Pradesh, and it is very low because of maybe their economic status and dietary pattern and other things. And the role of socio-economic difference in diabetes prevalence, and this Chennai study, CUF study, clearly shows that. So the social, because previously it follows the socio-economic gradient, but nowadays it is not following socio-economic gradient anymore by the diabetes. You can see so low socio-economic people, the increase is very high, 135%. If you come to the hypertension, and this hypertension also, we have carried out several studies among rural population, tribal population, and urban population. This recent CNNS survey among adolescents, the hypertension is very high. You can see some of the states, West Bengal is very high, and 5 to 9 years, and this is 10 to 19 years, and some of the states is very low, but it is a overall very alarming picture. And high serum triglycerides among children aged 5 to 9 years and 10 to 19 years also observed in this study. And prevalence of hypertension among rural men and women in all the states, you can see this is I already explained this, but it is varies from different states. But here also the Kerala is top in this women, and as well as in this men. Men is Kerala high, and women West Bengal, you can see. So here the prevalence of hypertension among urban population, this was also carried out during 2015 and 16. You can see 28% of people are suffering from hypertension, and 38% and 29%, you can see. And the proportion of population consuming salt, but some of the states, the salt intake is very high, especially Orissa, because the prevalence is very high in Orissa, and the salt intake more than 10 grams is very high. As per WHO recommendation or suggestions, any person cannot consume more than 5 grams per day. But you can see most of the people are consuming either 7 to 10 grams or more than 10 grams per day. So the average intake of visible fat through different recipes, these are the recipes contributing the high intake of the fat intake, you can see, especially cereal with non-vegetarian foods. And tiffins and snacks is contributing very high because oil may be adding here more. And this is poor diet can affect multiple generations, says expert. This is almost this is also true because epigenetic changes also will occur. So what are the preventive measures we can do? And these are the, if you come to the preventive measures, the WHO global targets, reducing risk factors, the premature mortality from NCDs, 25% reduction we have to do. If we achieve all these factors, we can see raised blood pressure, we have to reduce 25%, and tobacco smoking 30%, and salt intake 30%, and physical inactivity, we have to reduce physical inactivity 10%. All this you may be aware of that. The healthy diet is the choice, and these 4 groups of diet we should have in our plate every day. So energy giving foods, fiber foods, and protective foods, and bodybuilding foods. So we have to balance our food intake with these 4 groups. And the ideal intake of calories from this proximate principles, you can see carbohydrates, the calories should not get more than 55 to 60%, and fats less than 30% calories we should get from fat, and protein 12 to 15% we should get. But our diet survey of NNMB diet survey shows that especially in rural area, majority people and major calories are coming from carbohydrates, and this is the actual risk factor for developing diabetes, hypertension, and all mortality it leads to. So here another this NIN, we have prepared a my plate per day. Our plate should be like this. Half of the plate should be fruits and vegetables, and another 1/4 should be pulses, and another 1/4 should be 1/4 cereals, and 1/4 pulses. So this is the ideal plate or balanced diet everyone should have in their plate every day. This kind of things. So this is also a depiction. You can see our plate should, if our plate divided into 4 quadrants, and half of the quadrant should be fruits and vegetables, 1 quadrant should be starch, 1 quadrant should be protein, but we eat usually reverse. So only 3/4 we eat rice and wheat or something, only carbohydrates, only 1/4 will be other foods. So this kind of eating, we have to change our behavior and think. And usually people, if obese people are there, they usually go for fasting for some days and reduce the weight. That is not correct, because you do not have to eat less. You just have to eat right food and sufficient food. That is the main thing. And we have to, sometimes we have to control our temptations. Even healthy food also there, and unhealthy food, processed food also there. So usually we attract this, but we have to control and select healthy food. If sometimes the temptation also there, but if you happen to be eat this kind of processed foods, this kind of processed foods, you have to, the remedials also you have to go for. If anybody eat a pizza, so 250 calories you will get, and cycling for 1/2 an hour is mandatory. Okay, so these are the things we have to observe. And of course the fruits and vegetables is very important, and this I need not tell because everybody aware of that. And in this webinar, most of the people are maybe medicos and medical persons. And here the functional foods, what we call, all these are functional foods: vitamins, minerals, antioxidants, phytonutrients, hormones, and N3 fatty acids, and fiber. So this will maintain the a good health and balanced health if you consume. And ultimately the traditional food, what we eat, traditional food is very healthy food. Our plate should be colorful and not with artificial colors. And you can see that we are forgetting taking a traditional food. The advantage of traditional food is also given here, because lack of time I cannot explain all these things. But traditional diet is, even though it is bulky and retain more time, it cannot be digested easily, it is bulky, and all these important factors also you can notice in this traditional diet. And ultimately most of the people used to ask what kind of oils we can use. The recommendations of dietary fat intake is this, and what is the ratio of each oil also given in this slide as per the ADA recommendation. So, and another important thing is the fatty acid composition of cooking oils. This is also very important. And if any family is using daily oil for 4 liters, 1 liter of oil we can purchase from this group, and another 1 liter or 2 liters from this group, and 1 liter from this group, and 1 liter from this group. And we have to add 5 liters at least. Here, Tufa require more. That's why you have to purchase 2 liters. And ultimately, if any family is using 5 liter, this is a combination. You will get the balance of balance of fatty acids. And here, and another point also, please remember, don't mix all oils in one tumbler, because their boiling point and melting points also different. So that's why you cannot mix all oils together. And ultimately the take home message, so the fats and sugars and salt you have to reduce. And we are also advertising and campaigning the thoda kam, we have to eat sugars and salt, we have to less. And FSSA also coming with the thoda kam slogan and eat right food slogan. And you have to increase fruits and vegetables, dietary fiber, physical activity, and drinking plenty of water. So dietary guidelines for Indian population is available at NIN website, and we can use these dietary guidelines. And we are also revising now. And this also, we recently released this report, what India eats, and in all 6 regions of the country, we have analyzed and we have recommended. We have what are the gaps are there in our eating habits. It was clearly mentioned in this book. If anyone gets time, you go through this book. So this ends my talk, and thank you once again for giving this opportunity. And thank you all participants, those who are patiently hearing my talk. So ultimately the prevention is better than cure, because I am also a preventive person or a public health person. Thank you for giving this opportunity.
Thank you very much, sir, for this comprehensive and insightful presentation and helping us to understand and the important aspects of nutrition that we need to take care. So we will now move on to the second keynote address for the day. I welcome Dr. Samuel George Hanstack, sir, who is a professor and the head of the Department of Medicine 4 unit at Christian Medical College, Vellore, to give us a second keynote address on lifestyle and health. Dr. Samuel George Hanstack has done MBBS and MD General Medicine from AIIMS New Delhi, has done MA in Sociology from Annamalai University from Chennai, and he has a fellowship in medical education from Philadelphia, and he holds a diploma in International Board of Lifestyle Medicine. He's been the Deputy Registrar for Christian Medical College, Vellore. He's also been the founding member of the Asian Society of Lifestyle Medicine and the founding president of Indian Society of Lifestyle Medicine. He has many research publications in the peer-reviewed Indian and international journals and authored many book chapters. He is involved in developing a certified training program in lifestyle medicine through distance education in Christian Medical College, Vellore, and also pioneered the development of regional and national movement of lifestyle medicine through Indian and Asian Society of Lifestyle Medicine. Thank you very much, sir, for accepting our invitation. We are delighted to have you with us. Thank you, and over to you.
Thank you, Jyotsna. Can you hear me?
Yes, sir.
Okay, thank you. Just want to thank Dr. Avula for his wonderful presentation. I'm sure NIN has a wealth of knowledge and informations from across the country, which is quite an eye-opener for us to know how things have been developing in different parts of the country. Thank you so much for those presentations and the statistics that you have shared. As this is, as Josa also said, this is the 71st year after the World Health Day was appointed on April 7th, 1950. 71 years passed just asking a question: are we more healthy, or how is our health? Is a question that we all struggle with. Some things definitely has improved, others seems to be on the rise in an epidemic proportions. So here is where we are asking a question: how do we build a fairer and healthier world? The theme for this year. If you look at it historically, uh, each traditional understanding of health has been a balance. Look at the Chinese, the yin and the yang, the Greek through all those phlegm and biles, and our Ayurvedic system talking about pitta, kapha, vata. There's a balance that gives health, and out of that has come our definition of the WHO almost 70, more than 70 years back. Looking at all the domains, and I will spend a little time to really understand what it really means. We have different components of health, which we are all familiar with. The issue is over here is, 1 second, yeah. Uh, if these are the domains of health, how do we really look at it practically in our day-to-day care of our patients? We can expand it to different areas like financial, occupational, or we can make it more expanded by looking at center as wellness, the global consciousness, its sustainability, with many more domains that really influence as to who we are. uh, and here we are called to be physicians and clinicians taking care of the health of the patients. Most of the time, we are trained in medical sciences, All India Institute of Medical Sciences. That's where I did my training, and then I moved to Nepal. And interestingly, this institution was called BP Koral Institute of Health Sciences. What is the difference between medical sciences and health sciences? Then I came to Christian Medical College, and as much as a medical college, but you see some terms were there: community health, child health, mental health. What is the difference between the medical and health perspective? And that's what we are going to look over the next few minutes. Is when we look at from the biomedical perspective, we are looking at cure, but there's some things we may not be able to cure, and so we need to see how we can adjust in a given situations. The second component is our focus is on disease. This patient is a diabetic, sugars are high, just get the sugars controlled. We have different ways of doing it. We do it and we are happy, the patient is happy, we send them back. But here we are talking about focus on the person. So from the shift from focus from disease to focus on person is really we are talking about. Really glad to hear from Unicorpus of the various things that they're doing. And so we are going to learn together as to how do we do that. So today my objective would be is to introduce lifestyle medicine. What is lifestyle medicines? We know preventive medicines, we know community medicines. What is lifestyle medicine? So we'll quickly touch on the history, the definitions, role in prevention and therapy, and the scope of lifestyle medicine. It is based on this model that as much as genes do determine our health and disease, the environment does play a certain role, but there's a huge role that lifestyle does play, beautifully also shared by Dr. Avula. And we have always looked at lifestyle from a preventive. We have also moved towards promotive. But the question is, does lifestyle has any therapeutic role? And that's what I will be trying to touch over here. What is the role of lifestyle medicine in medicine? The American College of Lifestyle Medicine, which began its journey somewhere in 1913, and it's almost more than coming close to a decade of their existence, which have started looking at lifestyle with a little bit more scientific perspective. And this is what how they define is: it is an evidence-based medical specialty that uses lifestyle, that is optimal nutrition. We just heard that. That's predominantly whole food and plant-based, physical activity, stress management, adequate sleep and hydration, tobacco and alcohol cessation. We also heard that, as well as social support as therapeutic intervention, not just to prevent, but to treat and even reverse lifestyle related chronic diseases. So this is the mandate with which the American College of Lifestyle began its journey, and over a decade, there are many things that has evolved. So these are the different areas that we look at. The first thing is it should be evidence based. There are a lot of various kinds of practices that happens around us, which would be done through the past with some wisdom. Some of them would have wisdom, but some of them may not have the evidence. And so what they said is that let our practice be evidence based. If we have an evidence, let's go ahead and do it. If there isn't, then we should study and look for evidence whether it really works or not. And the main thing is to focus on the root cause. Do not treat the symptoms, high sugars, but treat the root cause. What is it that is pushing the sugars or the blood pressures high? And when we look into the perspective of disease, you realize there's a huge amount of things that is below the surface that we hardly try to look at in our traditional practices. We don't go into the social determinants. We are angry when a person smokes and doesn't stop smoking after our last advice. We get agitated, but we very poorly understand how do we change behavior. Metabolic risk factors we talked about. So the NCDs are just the tip of the iceberg, but there's a huge amount of things that lies underneath. There are a number of studies right from 1948 of famous Framingham heart study. Following that, you have studies done by different centers, Harvard, Hopkins, and different centers, which has shown the relationship of lifestyle to disease, and also shown how lifestyle intervention can reverse diseases. There's a very interesting longest living people groups. This person is by name Dan Buettner. He is a National Geographic editor, and he started his journey trying to study visit places where people were living longest, crossing 100 years. And he found some of those places and he wanted to know what is the key? How do people here live so long? And what he found was each of the groups had different lifestyle patterns. Japan, Italy, and United States, Loma Linda, they found different things which beautifully fits within the paradigm of health as defined by WHO in the areas of nutrition, physical activity, mentally, and the social togetherness and a faith-based culture that they had are something that comes beautifully together. And so that's how he called these places as blue zones. And out of that, he was so convinced that he started what is called as a blue zone project. That means if you change your environment, you would become healthy and disease would come down. So the few things that he identified was, which is already summarized by my previous presenter, Dr. Avula: diet, exercise, maintaining normal body weight. He very clearly mentioned it shouldn't be below normal and it should not be above the normal cutoff. Avoiding smoking. If you do this, your lifespan can be increased by about 10 to 15 years. So what is the role of lifestyle in therapy? Dr. Hans Deal, one of the pioneers in beginning a lot of studies, clinical studies on looking at lifestyle and its effect on various diseases. He was working in a center called Pritkins Longevity Center in Florida, USA. And there people would come and live in this lifestyle center. And there, over a period of 18 days to 3 weeks, they would put them through a lifestyle program. And this is the data that he put together. 864 patients with diabetes, about 74% by the end of 3 weeks were leaving the center without medicines. Hypertension, 60% going off medicines. Dyslipidemia, 23% decrease just in 3 weeks. Metabolic syndrome, 50% reductions. People who are advised CABG for their coronary artery disease, 80% did not require surgery. They were symptom free and they were able to do their regular activities. They also looked into cancers, breast and prostate cancers, and saw by intervention of lifestyle, there was retardation in the cell growth. So interesting and fascinating to realize how this could happen. Inflammations, it reduces inflammations within 2 weeks. Markers, they plunge by almost 45%. Now, just to pause over here to realize most of our diseases have a pathogenesis in the background of inflammation. if you realize the so-called metabolic disease that we think of are also has got an inflammatory background. The cancers, if you look at arthritis and cancers, you won't find a difference between the treatment and the medicines that we are using. All the biological agents seems to work both in cancer as well as in arthritis. That means the basis of all of them is where our inflammation goes away from the normal side. One of the landmark study was a lifestyle heart trial done by Dr. Dean Ornish, published in Lancet, where he randomized patients into two groups, and one was on a full plant-based diet with the other things of exercise and social connectedness and stopping cessation stopping. And what they found was that as much as lifestyle did reduce the coronary artery dimension, I mean, he continued for 5 years. As much as it brought down it increases the diameter size. You see, the people who are on the standard medications for ischemic heart disease, the diameter size only continued to decrease over a period of time. And that is something to say, are we doing the right things by just prescribing medicine or doing interventions thinking that we are doing good to them? Studies shows the disease still continues to progress despite all the medications. Somewhere a role of lifestyle is absolutely empirical. Even though we may do interventions or give them medicines, without lifestyle, disease have only shown to progress over a period of time. There's an acronym that people have used for lifestyle is New Start: nutrition, exercise, water, sunshine, temperance, air, rest, and trust in God. If I have to give a lifestyle prescriptions, which I try to do in a busy OPD to all of them, one-liners for each one of them: eat a whole food, plant-based diet, do regular exercises, water, sun exposure for about 20 to 30 minutes, avoid addictions, do deep breathing exercises, and sleep hygiene. I'll just touch on that. And of course, the spirituality. To have a meaning and purpose in life is so important, because that is one thing that determines our choices. Because in lifestyle, the key thing is making choices. And the most difficult and the resistant and the most stubborn thing that refuses to change is a change of behavior. And the only thing that can make things change is when we are able to help them see life in a different perspective. And unless you touch the spirituality of a person, very less likely you're going to coax them to be able to make changes in their life. A few words on sleep. The ideal prescription of sleep is to sleep for 8 hours. Why 8 hours? The first 4 hours, you have a physical repair that goes through. The next 4 hours, you have a mental and emotional clearing. If you sleep for 4 hours or 5 hours, you may get some physical benefits, but to have a clear mind, to do comprehensive thinking at a higher level requires a deeper part of the sleep cycle. So few things about sleep hygiene is early to bed, sleep at an early time, early to bed. Now early, we can divide it in different terms, but early means early people, it's difficult to put in a time to that. If you look at the nature and decide, so what do you say, what time should we sleep? If you look at the cycle given to us in nature, sleep when the sun sets, wake up when the sun rises. Now that may be practically difficulty for each one of us, but so you decide an early time. But the good principle is to sleep at the same time every day. How long should we sleep? As I mentioned, 7 to 9 hours. 8 is the time. The second thing about sleep is uh, all the sleep should happen during the night. Naps are not a good options. Preferably take a full sleep in the night time. Diet and sleep: early dinner, light dinner, avoid stimulants like tea, coffee, or any other stimulants. Bedroom, what should it be? Temperature should be low. It should be a pitch dark room. Little light in the bedroom can decrease the melatonin that is to be secreted from a pineal gland, and that can affect the quality of your sleep. So no light, no sound. Very interesting to look at diabetes. In 1939, when the American Diabetes Association laid down their mission statement, look at it. It says, the vision is a life free of diabetes and its burden. I mean, that is what they started. Today, we don't call it, we don't say that diabetes can be cured. Sorry, you have to take your medicines for your lifelong. There are two terms that we need to be familiar with before we know how to use it is reversal and remissions. Can diabetes be reversed is a question that people ask. Now, ADA has made a definition of reversal. Reversal of a disease implies that whatever was causing it is now gone and is synonymous with using the term cured. That means you can go back and eat the same diet and maintain normal sugars without medications or therapeutic diet. So technically speaking, in the current situations, you can't reverse diabetes because it means you are allowed to go back to your previous diet, which we would not suggest them to take it. So going back to the standard American diet, or we call it as a SAD diet, is not really what you want them to go. So the term that we can use is remission. And according to the American Diabetes Association, remission is defined as being able to maintain blood sugar below the diabetic range without currently taking medications to lower the blood. That means if you have changed your lifestyle, the sugar has come down, you can say confidently by this definition that you are in remission. So there can be different types of remission, partial, complete, and prolonged remissions. There are different values of HbA1c and the duration that is given, in which if you are able to maintain those values, you call it as partial, complete, or prolonged remission. So basically, health is about balance between all of them. So if I have to define what is health, health is a balance between these domains. So what is disease? Disease is where the balance tips to the disease side. It could be because of any one of the domains that it may be working on. And so what is healing? So healing is restoring back that balance, restoring back that balance in those domains so that we can restore back the health. So this is a new paradigm of looking at disease. That means I need to dig and find out in every domains of a person what is wrong and set that imbalance right. And studies shows that when you set that balance right, the disease and the physiology also comes back. This is the WHO NCD action plan. The top risk factors is what they have listed down, which they are trying to see how we can address it. Tobacco, diet, physical activities, and alcohol are the targets for intervention. So what is the scope? So we're looking at lifestyle from these scopes: services, education, research. Very important, networking. And services can be in different setups, and I'm glad to hear that Unicorpus is also doing that. So you can practice that in the hospital, in a center, in educational institutions, in workplace, in spiritual institutions, or in community. Training is what we are also looking at, developing a course curriculum so that people can go through these concepts of lifestyle. Most of us, as we have done our graduations, we have not been really exposed to these principles or the core principles of lifestyle. We have not been taught much about nutrition, physical activities. Okay, we know that, but behavioral change and nutrition and many other things have really not been taught to us. So all that we know is symptom is equals to disease and disease is equals to medicines, and that's how we have been practicing some medicines. So there is a course which is called the International Board of Lifestyle Medicine by the American College of Lifestyle Medicine in US. They do this program, and people who are interested can take it up. And then of course we need to build up researches and studies. Very nice to hear from Dr. Avula and the number of papers they have studied and published, which is a great resource for us to look into it and see and understand what our approach should be in our patient care. Now, I was talking about networking. Very key is behavioral change. And how do we do that? The only way you can do it to be in connection. How do we be connected? And so there can be different ways that we can be connected. Now, thanks to COVID, we are all getting more familiar with your media and networking system. And these are some things that is also coming up in a big way. Wearable devices, app-based health programs, which are done through medias. I mean, now you can call as e-coaches, health coaches through e-medias, and various other things are also coming up. We do have a professional body of Lifestyle Medicine Global Alliance, under which all the lifestyle medicine societies are affiliated to. The Asian Society of Lifestyle Medicine, under which the Indian Society we started 2 years back, and the membership is growing. We do have a lifestyle journal, the American Journal of Lifestyle Medicine, and there's also an international journal on disease reversal and prevention journal, which is promoting more and more researches, and these are being published here. It's a very interesting media there. You can log on to nutritionfacts.org by Dr. Michael Greger. He posts all evidence-based researches on lifestyle and disease. And so finally, the wake-up call, much of the world seems to be unaware. The world is living dangerously, either because it has little choice or because it is making the wrong choice about consumption and activity. It's not just living long. Jean Louise Calment, she lived for 121 years. It's not just living long and being healthy. You have a 90-year-old lady holding the maximum records of marathon, and you have another person. But our life should be purpose-driven, so that we can say that I have fought a good fight, I have finished the race, and I've kept the faith. So may God help each one of you as you think about it, as you think about your own lifestyle first, and what you experience in your own life, as you think of sharing it with others, is what really would be the way forward in our understanding of lifestyle. Thank you.
Thank you very much, sir, for the insights into the lifestyle and the importance of lifestyle, and also helping us understand the scope of lifestyle medicine. Just give me a minute. We will now move on to a panel discussion. Today our panelists are Dr. Avula, Dr. Samuel George Hanstad, Dr. Sushil Ketarian, and Dr. Dominic Benjamin. I will quickly introduce Dr. Sushil and Dominic. Dr. Sushil Ketarian, sir, has done MBBS from CMC Vellore and belongs to the batch of 1969, and he's also done MD in psychiatry from CMC Vellore. He is the head of the Department of Psychiatry in Christian Fellowship Hospital, Odanchatra, and also been the medical superintendent for the same institution. He is a member of the Christian Fellowship, the core group which runs the institution, and also been its former chairman. He is involved in teaching English, psychology, and psychiatry for the nursing students. He is involved in teaching psychiatry for postgraduate trainee doctors of National Board at CFH, and also the resource person for psychiatry for the distance education program of CMC Vellore. Currently the chairman of the Evangelical Medical Fellowship of India, and formerly the president of Association of Christian Counselors of South Asia. So we are very happy to have you, sir. Welcome, sir, and thank you for accepting our invitation. Dr. Dominic Benjamin has done his MBBS from St. John's Medical College, Bangalore, and done DNBE from St. Martha's Hospital, Bangalore. He's also holds a certificate in diabetes care from UK and specialty certificate examination in geriatric medicine and completion of specialist training in geriatrics, and an FRCP from Edinburgh and London, and an MRCP in geriatrics. He is currently working as a geriatrician, aging and diabetic specialist, and the head of the department of medicine and geriatrics. He has started the geriatric department at Bangalore Baptist Hospital, Bangalore. He has renowned awards into his account. He has won the Helical National Award for Meritorious Service in the field of geriatrics, given by the Union Minister of Health in 2020. He has also had a masterclass in aging from the Ukraine University. He has also won the National Vayo Shrestha Samman National Award given by the Vice President of India in 2018. He's been the part of the core team that has started Hospital at Home in South Wales, UK, which is first of its kind in the UK. He's also started a clinic which is called Age Well at Bangalore Baptist Hospital, which is also the first of its kind, and has authored many publications in international and Indian journals. Sir, we welcome you, sir. Thank you for accepting our invitation. We are very pleased to have you with us. So we will move on to our panel discussion. Our, our first question. Our first question is to Dr. Avula. So as we know, there's a rise in cholesterol levels in high-income countries such as Northwestern Europe, North America, and Australia. But in 2017, there's been a study which shows there's an increased cholesterol levels which are responsible for an estimated 3.9 billion worldwide deaths, half of which have occurred in the East and Southeast and the South Asia. So can you tell us what are the factors contributing to the rise of cholesterol levels in the Asians?
Yes, thank you for raising this issue. As you know, cholesterol is a small fat particles, and these are transferred through entire body as a small packages of cells into cells. And it's usually the cholesterol is also known as it is a HDL cholesterol, LDL cholesterol, VLDL cholesterol, triglycerides. Okay, so these are the components. And this is also true because in my presentation also I said that the South Asian susceptibility. So the one of the major reason could be the genetic reasons. So the genetic constitution of the Asian Indians is different from Caucasians and Europeans, and even 2-3 very good publications also come up that Yagnik, Dr. Yagnik also presented because their BMI. So if you see the BMI of European person and Indian person, at 25 BMI, both the people and the total body fat percentage is different because both BMI is same. But at the same 25 BMI, a European person, the body fat percent is only 18%. At the same time, the Indian person or Asian Indian, the body fat percentage is 36. So BMI is same. So that is the susceptibility, the affinity of fat deposition in Asian Indians is very high. So that is one reason, and another reason could be physical inactivity. So the Asian Indian physical inactivity in some of the studies shows that the physical inactivity is very high, and it is increasing. And you may be aware of everybody's experience that the physical inactivity is grossly reducing. In our own NNMB studies, I told the National Nutrition Monitoring Survey, we have also collected time trends of physical activity through their lifestyle and through their occupation based. And what we found is in 1975-79, physical activity was around 76%. But now physical activities come down. Physical inactivity become now 74% instead of 36% 30 years back in India itself actually. So the physical inactivity is also increasing. And third one could be the unhealthy diet, because unhealthy diet also majorly practicing in different parts of the country. And only few people are following healthy diet, and majority population in Asian Indians, they are not following a healthy diet. That also several reasons. The reasons could be even poverty, ignorance, and even knowledgeable people also, they are unable to practice. Even behavioral change communication also very important. So these are the major issues that may be leading to raising cholesterol. And even recent surveys also, we have conducted extensive survey on cholesterol estimation around 50,000 population entire India. And our prevalence of cholesterol is cholesterol level hypercholesteremia is almost 30%. Thank you.
So our next question is to Dr. Samuel Hanstad, sir. Just a sec. In 1947, WHO defined health as a state of complete physical, mental, and social well-being, which we have already seen during our presentation. But over the years, the physical well-being has been given more precedence. So, and the concept of mental and social well-being is less defined. So, and research also shows that emotional distress creates a susceptibility to physical illness. So, could you explain what the importance of emotional wellness in maintaining one's overall health?
I think we have a expert
Yeah,
around
this,
us, Dr. Tarian being there.
yes.
I guess it's interesting from whatever perspective you see, whether you see it from the nutrition, whether you see it from the physical activity, whether you see it from the stress perspective. Often the stress is precipitated because of a social interaction, and everything finally is determined by who we are and what our perspective about life is. So either ways you study from anywhere, you realize that each of these shows unwellness or illness that comes in our life when we do not follow these domains and those principles. So I mean, it was surprising as I was preparing for a presentation on sleep to realize how much sleep has a role in different parts of a disease per se, which we are ignorant. We have hardly known many of those things. But the same thing, if you look at exercise has so much of relaxations, the good hormones going up, you're mentally being relaxed. So everything kind of works. So just answering to your specific question of emotional wellness, and if you're looking at EQ is basically how do we interact with people. These days, people are looking people with high EQ rather than high IQ. If you take people with high IQ, you have to be prepared to bear all the idiosyncrasies that brilliant people have. But they are looking at people who can get along with you and support you and work together as a teamwork. And companies actually do better with people who can work as a team rather than having simply brilliant minds. And so EQ is a full subject by itself to see how we can understand, how we can accept people, how we can understand them, how we can work together. And often there's a little component of reflective interactions with people, so that do not be reactive. Sometimes we just react to people, but between a stimulus and reaction, if there's a gap and we have a little time of reflection and we start responding reflectively, our reactions will be much different than when we react in a reactive way. And so emotional wellness is all about pausing, reflecting, and responding in the most appropriate way, which it does achieve an output and keeps you in a very emotionally and mental stable state. So in a nutshell, to the big question is what my response would be.
Thank you, sir. Dr. Sushil, would you like to add something?
I hope you can hear me.
Yes, sir.
Yeah. It is. I think it's one of the general secretaries of WHO who said there is no health without mental health. So that just summarizes the importance of mental health in our well-being. So I mean, there's no question that without a good mental health, you cannot really be healthy. That's what I mean.
Yes. Thank you, sir. Yes. So we'll move on to the next question. Our next question is to Dr. Sushil again. So, as we were speaking about mental health, depression is one of the most common mental health disorder and leading cause of disability worldwide. And depression, as we know, can lead to suicide, and suicide is becoming the second leading cause of death in the age group less than 30. So would you please tell us the causes of depression amongst different people groups, and also the preventive or coping strategies for the same?
Yeah. In general, the prevalence of depression, we could say, maybe around 10% of the population anywhere, and it varies. And as people grow older, the chance of getting depression is more. And if you want to know the cause of depression, to simplify, because there are multiple causes, not just single cause. To simplify, I could say it's either the increase in stress or the ability of the person to cope with the stress. So either of these things can cause mental illness. To go into a little more detail, you could say the stress can be physical stress, physiological stress, and psychological stress. Physical stress, meaning it could be anything that's outside the body, like the environment, like a sudden catastrophe that happens, maybe an earthquake or a tsunami or something like that. Or it could be an internal, like any types of illnesses that we have. And physiological, especially, particularly for women, the different physiological stages like menarche, pregnancy, delivery, menopause, these are vulnerable changes in a person's life, especially in a woman's life. Especially delivery, postpartum depression is a very common depression. These are the physiological causes. Then this psychological stress, that is mainly the problems with relationships. That will take a big chunk of the psychological part, problem with relationships. Then it could be any kind of loss. It could be monetary loss, it could be loss in relationship, loss of prestige, loss of people, loved ones, any of these losses. Then other causes like frustration, conflict. These are some of the common causes of depression. And as people grow older, one of the causes of depression is loneliness and a feeling of redundant. Now they're very active, but now they feel they are no longer needed. And suddenly, especially when people retire, if they're not really prepared for their retirement life, it's a big change for them. People suddenly, when they retire, they have nothing to do. Or they are not prepared themselves, planned for that change, and then they can become depressed. And suddenly, people who are all respecting you so far, and now they have changed their focus on somebody else, and suddenly you have become a nobody. These are some of the causes for depression. And again, social changes, change in the family, children move away from home, and sometimes when it's older, your spouse may become very sick or may die. All these are causes for depression in older age. So the important thing is keep oneself active, and nothing like doing something for others. So that gives a lot of fulfillment and a feeling that you're being useful. Beyond your regular work, always try to do something extra. What can you do for others? You make somebody happy, somebody's life better, something out of the way. And that is one way to still keep yourself relevant. You're not redundant, you're useful. That's one way to prevent. And have more people to communicate with, talk to, have more friends, keep your relationship active.
Thank you very much, sir, for beautifully explaining that. So we will move on to the next question. The next question is to Dr. Dominic. As globally, the population of the age of 60 years and older is increasing, and between 2015 to 2050, the proportion of the world's population over the 60s is estimated to double from 12 to 22%. In absolute terms, it increases from 900 million to 2 billion people. And the United Nations has also declared 2021 to 2030 as a decade of healthy aging. So would you define aging for us, and also talk about common health conditions associated with aging?
Thank you, and thank you for having me on. I think it's one of the most complex definition. Am I audible?
Yes, sir. You
Okay, yeah. Aging is not a linear process; it's a complex, heterogeneous process. Each person ages in a different way. It depends on the genetics, the epigenetics, the environment. We age from the time we are born till the time we die. But actually, the objective aging starts when you're in your late 20s. So it's also non-homogeneous. So a person's liver may age at a different pace to his lungs, or someone's brain may age at a different pace to his bones. So I think it's there's no accepted definition of aging, but it's a very complex, heterogeneous process that people go through. So what are the common health conditions? I think my previous speakers have mentioned to it and alluded to a lot of things. And put in a simple way, we have most of the older people face a triple whammy. One is that non-communicable disease is still very huge and rampant, and that takes a huge toll on them. Number two, still infectious disease still kills people in a big way. Number three is malnutrition, obesity, or nutrition-based diseases, which takes a big toll on them. So, what are the health problems? The common non-communicable disease, diabetes, hypertension. It's all in public domain. So what's the difference between an Anglo-Saxon and an Asian aging? Is the problem is that most of the people, by the they come to the retirement age of 60. 60 is basically a number. First of all, basically it's a number. As Mark Twain famously said, "Is age is mind over matter. If you don't mind, it just doesn't matter. What your age does not matter. It's just that what's your attitude." So I think the problem with a lot of Asians and especially Indians is that their biological age is much worse than the chronological age. So the 60-year-old man, gentleman, will behave and act as if he's 75. You know what I mean? So basically, they are more advanced in aging. And the problem with a lot of this chronic long-term diseases, they wouldn't have looked after themselves. They wouldn't have gone to a proper doctor. They wouldn't have been proactive. They're more reactive. The conditions are not optimized. So when they come to the 60s, instead of enjoying the harvest of labor, they will be spending all the money to the hospitals and things. So I think that's a major difference in the way that we manage. And people don't acknowledge the chronicity of the disease and manage them. Of course, as my previous speaker mentioned, mental health is a huge thing. And aging is physical, mental, social, cultural, spiritual, environmental. So I think all dimensions should be put in. And so I think mental health is a big thing. Mental aging is a big thing. And Corona not only brought out the infectious pandemic, it also brought out the mental pandemic, what people go through. And loneliness is the cancer of the mind. And that's a huge problem. So I think it's all combination. I can't delineate mind, body, and spirit are together. So I think the problem is the way we look at aging in India. It's sort of it has got a social taboo. The way they look at it, that after 60 they all grow old. So in my clinic there are three buckets that I can make into. One is people who are very proactively aging. That means they think about what happens when they're 50 or 60, start take measures in their 40s. They regularly visit, and more of preventive medicine, vaccination, health checkup, and getting them in a body shape. Other than active people, they do the job, they go to the doctor, manage to get the blood sugar control, but they don't do anything proactively. And third is all the people who, most of them are playing catch up. That means the disease is advanced, the organs have been affected, they all play catch up. So I think it's not a very pretty scenario, I'm afraid. I think the biggest challenge for them is that this generation did not expect the socio-economic changes to happen. So they had a sense of entitlement, the children to look after. To them only. So common health disease and health and physical health.
Hello. Yes. Thank you, sir. Thank you. Our next question is
to
Dr. Avula. So we have already you have already discussed prevalence of obesity in your presentation in childhood. So can you just, in a nutshell, can you tell the audience what are the preventive strategies that they can take as parents to prevent obesity in the children?
Obesity is a multifactorial, as we discussed with my presentation also, because especially childhood obesity is a big problem, and not only childhood obesity. Our recent studies, the NFHS score and other studies, even CNNS studies, shown that even NPNL women, pregnant women, lactating women, the overweight obesity is very high. So the preventive measures, we cannot target a one group because it is a specific to specific group. Suppose childhood obesity, we should have some different strategies, because the health education system. I already explained that obesogenic environment they are living children, and then this is basically the determines. If you see, it is a sociological factor, psychological factor, behavioral factors. These all the three factors we have to address in order to control overweight obesity. And it is very difficult to reduce the overweight obesity also. Even the WHO forum, the control forum also, because there is no target for reduction of overweight obesity. Target is given only zero change, because we should not allow to increase overweight obesity prevalence rather than reduction. So it is a very complex one, and it is a one cannot control the overweight obesity. It is just like societal influence or societal strategies, and individual preventive strategies, and government preventive strategies. All together, we can control the overweight obesity. And the national government also started a program, the prevention of national program for prevention and control of cardiovascular diseases and mental health. And so it is a very comprehensive program, and the objectives are mainly 4 objectives, and one of the objectives is promote the physical activity, and then also promote the healthy food, and then of course screen and treat. So these are the main objectives of the prevention.
Thank you, sir. Thank you very much. So next question is to Dr. Samuel Hanstad, sir. Sir, would you please explain what corporate wellness is, and also what are the guidelines for establishing a wellness program or a health model in the organizations, if there's any?
This is a 1-hour presentation. So anyway, I was just joking. Just want to thank Dr. Abula about the childhood obesity. We just finished writing a holistic health textbook for the students from grade 1 to grade 10. Now that is just a textbook, which is once in a week sessions will be taken by the trained teachers on different aspects of health. So the objective is one is to change the teachers, because teachers themselves may not know many things, and to influence the parents, because without touching the parents, whatever knowledge you give to the students will not happen. And so this is something that we are going to see how it works and what are the challenges that comes on the way. But that's an initiative that we have taken, because at CMC Vellore, the Department of Endocrinology had done an initiative at Scudder School of having one theme per day. So like our children would come home and say, Mommy, today's apple day. So everybody has to take apple over there. Today's a fruit day, today's a vegetable day. So they tried different ways. And what is interesting is that children have a very clear mind. When you tell them something and they understand that this is right, often they would take a stand, no, this is right. Our teachers have said, no, that is bad, we should not take that, and we should do this. Then parents are in a fix, they can't fight the children to tell them, no, continue doing the wrong thing. So actually, students can be a vehicle to even change their parents and the families if we are able to work it out well, plan it out well, so that the students and the parents and the teachers, if they change, I mean, that could be one concept that you can start off, and that will be very interesting to see how it works out. coming to corporate wellness, I think there are a lot of corporate programs that is coming up. And I guess, as I mentioned, the focus of health work has to be in communities. You suddenly realize that most of our time actually spent in a workplace most of the day, and we spend a little time at home, and all that we do is sit, eat, have a little chat, and sleep. So if you have to make a significant change in the lifestyle of a person, we should actually have a very strong corporate wellness program. And it would basically mean doing all the regular things. You do the basic physical checkup, investigational checkup, you have series of sessions. Use group dynamics. I think the key is two things are there key. One is a group dynamics. When you see somebody doing it, you are also interested to do it. If somebody is climbing up the hill or going for cycling and all, I mean, left to me, I may never do that. But if the group is going, there's a little group mentality that we all want to do. So group dynamics is one thing that people are more and more using at all levels. And second is something called a health coaching. So if you are the 10 people, you put the 10 people in a group, have one person to oversee that, who will be acting like a coach, listening to them, understanding them, encouraging them, helping them to fix their targets and goals. So coach is not who dictates you what you should do, but a coach who helps you to set up your own goals and helps you in that passage. So the concept of coaching, the concept of group dynamics, and something that you begin and continue. It is not one-time program that you do it and don't do anything. The fallacy is most of the corporates have health programs. They ensure that everybody does a health checkup. After that, nothing happens. I mean, nothing more than that. I mean, that's the least way it could be effective. And interestingly, study shows health checkup actually doesn't change anything, doesn't reduce mortality, except spending money on health checkup. So we have to be a little careful about how we use it in an evidence-based way. But the most important thing is use that environment to inculcate a team spirit of doing certain things together. And so wellness program and health models are something which are kind of evolving. There's no one way of doing the right things. I would suggest that it should be a group of people who should get together. They should do a little survey of your employees to see what is there in their mind, and taking it up, prepare a program that is doable, feasible within the working hours, to encourage them using group dynamics, using coaching concepts. And in that way, you're not just looking at the physical dimensions of just making them eat well and do some exercise, but you can also listen to the issues and challenges of life and see how as a corporate way we can help them even in those areas. Now that's a big area, but HR departments and all those things are actually supposed to be looking into those, because if employees are healthy and happy, so it's not just healthy, are happy, your productivity of your institution and organization is much different. Studies have shown that even the amount of money that you spend on the health actually comes down for the investment in the wellness program that you do. So it is also cost effective to invest certain amount of human resource and programs that you do for them, because on a long term you actually benefit financially also, apart from the benefit of health and the happiness of your employees.
Thank you very much, sir. Thank you. Yeah, we hope to set it up at Unicorp soon. So our next question is to Dr. Sushil. Sir, so how do we recognize and diagnose dementia and depression in older adults, being given these are the most common neurological and mental health disorders?
Let me start with diagnosing depression in old age. It is the same as in any age, in younger people also. Usually the starting sign may be a sleep disturbance. If somebody has a sleep disturbance, especially with early morning awakening, which lasts more than 2 weeks, then one should suspect whether it could be depression. Then what do you do further? We can ask for other symptoms of depression. Do you feel joyless? Do you think the things which interested you earlier fail to interest you now? So your hobbies in which you are interested before, now you feel no enjoyment in that. This is what we call as anhedonia, inability to enjoy things. And then a general disinterest in everything, especially the older person, when the grandchildren come, naturally most old people are very happy. But now the person finds it a burden. And even ordinary things also, they find it a burden. Everything is irritating, things like that. Then there are three symptoms which described by Aaron Beck, who is called the cognitive triad. That is, ideas of hopelessness, ideas of worthlessness, and ideas of helplessness. What we mean by that is, ideas of hopelessness, the person feels so nothing will improve, things are going to become worse. Ideas of worthlessness, the person feels I am not of much use to anybody. I am a burden to the others. I am not of not much use. That is the worthlessness. Helplessness is a person feels that he is unable to do anything. Things which he used to do before, now I am not, I can't. So, hopelessness, worthlessness, helplessness. Now, along with that, some changes like change in appetite, appetite is less, weight loss, constipation. If these are there, then most likely the person has depression. Of course, the common sign is crying and that. Then if the depression becomes more, the person may begin to develop suicidal thoughts. It's better that I die. Some people may even attempt suicide. So the way we recognize depression in old. Now for dementia. Dementia usually starts with forgetfulness in older age. They can also have some changes in behavior, like person either talks more or talks less. Not non-stop talking, but the person goes on talking, tends to repeat himself a lot more than before, and forgetting where the bathroom is, where the kitchen is, going to the wrong room, and not able to remember certain things. The difference between this forgetfulness of depression and forgetfulness of dementia is that a depressed person will easily give up. You ask something, what I can't remember. Very easily he'll say, I don't. Whereas a dementia person will try hard. The tip of my tongue, man, what's that? He'll try hard to remember, but he's unable. A depressed person will easily give up, easily he'll say, I don't. So much so, we call such a forgetfulness and depression as pseudo-dementia. Not dementia, but pseudo-dementia. So that's the main thing, is forgetfulness, losing memory, the early signs of depression. Then as a sign of dementia. And then as it goes on, person may forget how to wear the sari, how to dress, how to do the cooking, which the person was good earlier, now he misses the certain steps. These are the early signs of dementia.
Yes, thank you, sir. Thank you very much, sir. Our next question is to Dr. Dominic, sir. So, what are the most common misconceptions about aging, and what are the truths about aging and health that you come across with your patients?
With regard to misconceptions, I think aging, as I mentioned to you, has got a very negative connotation in this part of the world. People use the word old. I don't use the word old, it's older. My brother is older to me, not old to me. And people think that after 60, your shelf life is over. People spell retire as R-E-T-I-R-E, but I would like to spell it as R-E-T-Y-R-E. You need to retire it and move forward. And aging is an extraordinary process where you become the person that you always should have been. I think, what do I mean by that? So nobody grows old just because they live a number of years. He grows by he grows old by deserting ideas. Years may wrinkle your skin, but I think once you lose enthusiasm, it wrinkles your soul. What do I mean by that? People don't have these two words in their inner being. That is, they don't feel valuable. They don't feel valued. They feel that after a certain age, they're not valuable enough. They're not valued enough. When these two words come into their system, they start sort of unraveling. One of the good things about Corona is this: a lot of older people understood that they can be tech savvy, not tech savvy. They can be tech neutral, or they can be tech learning. Most of the younger people think that older people can't learn. They can't be tech savvy. And second thing is that, as I mentioned to you, loneliness is cancer of the mind. Younger people used to say that of TVs. In the UK, in the Western world, there are ministers only for loneliness. So that's such a major problem. So I think misconception is the thing, and people don't understand number. It's an attitude. So I had a 100-year-old who got vaccinated. There's a 90-year-old who wants to learn Bharatanatyam. So it's all about how you look at aging. But here people have a misconception. They think that you attend a shelf life and it's all over. Your time has come and things like that. So I think it's more an attitude and the way people look at it. And also things have changed. When I was growing up, I'm not very old. I'm still very young. It's just that when you see an older person, people used to give place for you to sit down. But nowadays people don't have that. And also the perception of older people is this: once they come to 60, they think that it's all over. Whereas a 60-year-old man, the 60 is the new 40. They may think about, going on a holiday, changing the house, learning a new skill, things like that. Even the individuals have a problem. The perception about how they view old age. Yeah. So I think it's both ways. Both the society, the way it looks at it, how they look at aging is a complex process. How do we bring about change? I think it's over a period of time. First of all, teaching values at home, that making them feel valuable. They lost, although in the good old days they were consulted for every important matters. Now they're not consulted. And also the media projects aging as a very negative thing. So I think the whole lot of things comes into play. So it's more of an attitude change that we need to bring about, and it's about visual optics. We need to get the optics right.
Thank you, sir. Very true. So our next question is to Dr. Avula. So could you tell us the importance of reading food labels and how do we interpret them?
Because importance of food labeling, this FSSI, Food Safety Standard Authority of India, now they started because this food labeling is a forgotten issue in India, because 75% foods are manufactured in non-organized sectors, because without label, just they pack in the cover and sell it, most of the things. But now Food Safety Authority of India now taken up this, and there are some prescriptions, some guidelines also given how to label. And we have conducted 2-3 research studies on that food labeling, how many people are reading food labels, and what is the behavior of the people who come to the purchase. So in this, we surprisingly 86% of people only they read two things. One is expiry date, and another one is only price. These are the two things, because there is a nutrition information is there, because the compulsory now the government of India make a law, food label law, but the enforcement and implementation is not happening so far. But as per that, they have given the guidelines also. Even as a mandatory, some of the nutrition industries, they are printing the nutrition information very small letters. Maybe it may be 7 or 6 fonts. Nobody can read. until unless if you put here some glass or something. So then now the guidelines also recently issued the Food Safety Authority of India. The size should be at least, the font should be at least 12 to 14, and it should be front of the pack. So this will definitely help whoever is some educated, especially children, school-going children, adolescents, young adults. Any pocket before buying, they should read the nutrition information. And it is clearly the nutrition label guidelines also there, because I am also one of the member in the label committee in the FSSI. And suppose if one pocket one person is consuming, so how many calories he is getting, and how much fat is getting, and what is the percentage of trans fat is there in that pocket. So the whoever is consumer is there, so they should read before buying that pocket whether I am eligible to eat this pocket, how many calories I am getting, how much fat we are getting. And now we have also recommended to that how much percent of RDA we are getting. Suppose for a person this many calories RDA, recommended dietary allowance, or the recommended dietary intake. So suppose we need 2000 calories per day. Out of 2000 calories, we eat a processed food, how many calories you are getting? So those kind of labels come into force now. And definitely this food labels is useful to control overweight, obesity, hypertension and diabetes, and especially unhealthy food. Some of the foods only, it is a energy dense foods. Suppose fat or other thing, fat is only give energy. And so many beverages, so soft drinks, those kind of things also. Food label is very, very useful, and everybody should read the pocket nutrition information before buying and before eating.
Yes, thank you, sir. Sir, Dr. Dominic, sir, you had a question? Or
No, I
you
didn't
would
have a
like to
question.
add? Yeah,
No.
you would like to add?
The food label.
Yes, sir.
Okay.
You raised your hand. Yeah.
No, I didn't. I did. I by mistake. No, I think nothing. But
Okay,
no,
okay.
nothing.
Sorry.
Fine. I think I just want to tell you, in the Western world, it's more of a green lighting signal. It's amber, green, or red.
Yes.
You see green, you buy. If you see red, you don't buy. When you're amber, you make a decision whether you want to buy or not. Much simpler thing. But I think we are fully loaded with poison. The vice of 21st century is salt and sugar. So I think it's much more loaded. No, not thank you. Josna, I think I need to leave because my daughter's birthday today.
Okay.
I think I can't
Okay.
be. If anything
Sure,
is there.
Wish you happy birthday. Convey,
Yes, sir.
convey our wishes.
No, not mine. It's my daughter's birthday. Yes.
That's
Is
what-
there any question that I need to answer?
What gift did
yes,
you buy for your birthday for your girl?
Well, plenty of clothes. Yeah. So she's a teenager, so they. Yeah.
Okay. Sure. Wish her happy birthday from our side.
I will. Thank you, Jen.
Yes, sir. It's I think just a couple of questions, but I think if you're in a hurry.
No, if you want me to answer a question and then leave, is that
Yeah,
okay?
yeah. Yes, sir. Yes, sir. There. Yes, sir. What are the strategies to promote healthy aging?
Ooh, okay. How are the strategies? Change your attitude. See aging as a cool. Aging is fun. And start, as I told you, don't retire. You retire, R-E-T-Y-R-E. Start new objectives. Have purpose. Learn a new skill. Have a jingle and fun. The oldest rock band is Zimmers. The average age is 80 years old. The lead singer was 100 years old. So we have a Mount Everest climber at 80. So age is just a number. It's mind over matter. If you don't mind, it just doesn't matter what age you start. A lot of my patients are cool, and I had a 75-year-old, 4 couples drive around 8,000 kilometers just to have fun and jingle. So I think basically there's no time limit for you to learn, to have fun, to have jingle. Most important thing is mental health, physical health. And as I told you, the Grant and Gulick study, the famous study, prospective study for 75 years, it showed about, relationship is the most important thing. Relationship with God, your fellow men, and relationship with how you deal with people. And so I think that is the most important thing. The two most important words for every older person is, are you valued or valuable in a relationship, in the environment that you live in, and things like that. So most of the older people are existing. I want them to start living. The difference is not apples and pears; it's chalk and cheese. A lot of them think they're living, but they are just existing. I think the thing is that they need to change the perspective. They need to change the look at the way they look at it. And also, we need to also look at every older person and saying that he's just 60 years old. That's a new 40. He's 80-year-old. That's a new 60. People are going to live longer, and 1/3 of a life is going to be post-retirement, RETY retirement. So just start something new. So I think it's all a lot to do with the attitude and the environment that you live in. The environment that you live in is a very, very important thing for you to think. So I think aging is cool, aging is fun, and it's a fun process. So I think you don't need to be afraid of aging. You need to embrace aging. That's what it is. Thank you for Unicorpus, and thank you for all of you.
Thank you.
I'll take leave. Thank you.
Thank you, sir. Thank you
Thank
so
you.
much, sir. Thank you for joining us. So our next question would be to Dr. Samuel, sir. How do we design healthy lifestyle interventions that work for our patients as clinicians?
Yeah. A few things we are trying to do is, number one is we are trying to keep a prescription pad, a lifestyle prescription pad. So what you can do is you can just have printed out things. One of the things, as I mentioned, was New Start. You can use any of the abbreviations. So something that you can write it and give to every patient that comes. You may not need to emphasize everything for every patient. Each patient may have a specific area that they need to work on, and you can tick those and give it to them, but they have the other advice also written up over there. On the back side, you can have few details or calculations and equations that can be noted. So just having a prescription, lifestyle prescription pad in an OPD can be a good way to start off with. That's one. Second is, there are people who require a little bit more time because their situations may be a little so fish out those people. What we do is we have about a 2-hour session with those group of patients. We do it in a group and we take them through the whole thing. We do a baseline evaluations and then we take them through things. Follow-up is still a challenge. We have not really figured it out. Sometimes they send messages through WhatsApp and we kind of do it, but we are working with VIT to look into electronic monitoring of the parameters using wearable devices and an app-based kind of a wellness program. So if you have IT guys and all, you can sit with them and they can help you out, because that can make things much easier. A lot of educational things also, you can post it in a bite-size information which can happen over a period of time, and then having group sessions for them to come and share what things are happening, where they are struggling, and some of those things can really help you as a part of your outpatient care.
Thank you, sir. Thank you very much. Sir, our next question is to Dr. Sushil, sir. How does one maintain good mental health and well-being during this current COVID-19 pandemic?
Yes. One of the problems during this COVID time is emotional problem is anxiety. And this anxiety is very often because of false information. And as somebody said, whatever you hear in WhatsApp, take it that it is false unless proved otherwise. So a lot of exposure to media, a lot of false information, a lot of access. So try to get more authentic information, what is right. Second thing, if you're old, above 45, get yourself vaccinated. That will reduce your anxiety. In the sense, I have friends in Harvard University, immunologists, who say that if you're vaccinated, even though there is a chance of getting infected, you may not die. So far, there's no report so far of anyone who got vaccinated and got infected have died or had any serious consequences. So it is a good thing to do. So I want to kiss this person's mother-in-law is 95 years old in Bangalore. She got herself vaccinated. So Age is no bar. And take proper precautions, like anybody else, to reduce anxiety. And during this COVID time, again, as it is already mentioned, most old people are now learning to use the technology. So keep contact with people, talk to people, listen to webinars, good webinars. These are some ways to reduce one's anxiety, and try to find things to do, make yourself useful, learn some new skills. Many things we can learn sitting at home. These are some ways to cope with the stress of the COVID time. And tomorrow is not in our hands, it's in the hands of God. And remember, God is still on the throne. So we feel that things are going haywire, we are helpless. Yes, we are helpless, but we are in the hands of Almighty God. Trust in Him. He will do only what is good for you and for you. Keep that trust in God.
Yes, sir. Very true. The only thing that can keep us going. So the next question, we've already addressed this. So to Dr. Avula, sir, what is the importance of plant-based diet in prevention of diabetes, hypertension, and obesity? I mean, to be more specific, and why should one be mindful of having plant-based diet?
So my presentation also, I already covered some of the most of the plant-based foods, because plant-based foods will give a lot of fiber, antioxidants, phytochemicals, and also most of the plant-based foods also consist of magnesium. So these can reduce the even diabetes and as well as hypertension. So it is very, very important for most of the meal should be plant-based rather than other fish and flesh foods. Of course, fish and flesh foods, a lot of micronutrients also there, but at the same time, it should not be. We should not. The people should not eat majorly on this non-vegetarian. So fortunately, in India, most of the people are non-vegetarian, but all people are a weekly non-vegetarian. Most of the people don't eat daily. So that is one advantage in India.
Thank you, sir. Our last question, we've already discussed this. What advice would you give to older adults with underlying health conditions during this current COVID-19 pandemic? To Dr. Samuel, sir, Dr. Sushil, please. Sir, unmute yourself, please.
Yeah, thank you for that question. Older adults with underlying health conditions, geriatrics is also there. It's again talking about the healthy lifestyle. It's interesting that you can do many things within the house also, even in times like lockdown. You can do some exercises, jumping on that same place and doing some stretches, and those kind of exercises is also possible, not necessary that you have to go out. Cooking healthy food is generally easy as compared to when you do the traditional cooking with a lot of things that you have to prepare. So in a sense, trying to apply things like millets and other things which has long been forgotten is slowly coming up. Of course, the market knows what to sell and what to package, and they have started packaging and pricing it also a little high. But then these are some things that is slowly coming back to the market that we need to look at. So advices to the elderly people during the COVID times is to keep your immune system healthy by following all the principles of a healthy lifestyle. And once you are able to do that, either you may not get the infections, or if you get the infections, you'll be able to manage the infections better than when your immune system is not so well. One thing we have found very strongly is the association of diabetes with COVID. And diabetes is a peculiar disease. It's beyond just the sugars being high, but that is almost becoming a bottom line for most of your patients admitted in the wards. For almost every other disease, if you look at all malignancies, almost more than 70-80% would be having diabetes. There's something to do with most of the NCDs. We strongly believe the common denominator for all of them are inflammation. And if you look at from a pure inflammation point of view, then you're choosing your food that is anti-inflammatory. Exercise is anti-inflammatory. Stress is pro-inflammatory. The more relaxed you are is anti-inflammatory. Maintaining relationship with people, having a purpose in life, all these are in a way reduces your inflammations, reduces almost every disease that you know of. And so all that you have to help a person to understand all the domains of health and encourage them to be healthy so that they can remain safe.
Thank you, sir. That brings us to the end of the panel discussion. There are a couple of questions asked by the audience, but most of it has been covered either in the panel questions and or during the presentations. Thank you, sir. Thank you all for joining us today. Thank you, Dr. Avula, sir, for the wealth of information that you have from India and abroad. And thank you very much for all your insights and all the data that you have shared with us, which is very valuable to us. Thank you so much for accepting our invitation and giving a precious time to us and our audience today. I also thank Dr. Samuel Hanstag, sir. It's great to have you in this webinar, sir. And thank you so much for all that you are doing in the field of lifestyle medicine, and for pioneering and pushing forward lifestyle medicine as a preventive medicine. And thank you so much for all that you do, and thank you for joining us today, and thank you for sharing your insights and also about the lifestyle medicine and the scope of it, and for the benefit of all the medical postgraduates and undergraduates who are here. So I also thank Dr. Sushil, sir. Thank you so much, sir, for giving us your precious time. There's so much to learn from you. There's so much to understand about mental health and the way you deal with it. And there's, I mean, just by the way you talk, there's so much hope in everything that you say, and how to cope with different issues like depression and things like that. And thank you so much for all the work that you do, and all the counseling that you do for your patients, and also for the work at the EMFI and the Christian Fellowship Hospital at Road and Chatram. Thank you so much for joining us today, sir. So I also thank Dr. Dominic, sir, who has joined us and for the panel. We thank him very much for all the work that he's done, and his pioneering work that he's done in setting up this Age Well Clinic, which is for one of its kind, and also his perspective and his outlook to life, which can be a starting point to bring awareness of healthy aging which is very much required in the current generation. So we thank all the speakers and all the panelists and all the participants who have joined us from different parts of the country, within Hyderabad and outside, from different states, and also from the US. And thank you so much for all the medical students who have participated. There were medical students, interns, and PG students also who've been in the audience. And thank you so much for all those who have joined us from Mission Hospital setting, and hope and pray that this had been a very enlightening session and insightful session for everyone. So we also thank Kavita madam, who's a CEO and of Unicorpus, and also for being helping us technically to organize this webinar on Zoom meeting today. We also thank all the staff from Unicorpus who joined us from both centers. We also thank all our supporters who've helped us through this journey. So we now currently we next move request Mr. Kumarvel,
Yes, madam.
yeah, who is a physiotherapist at the hospital, to close in the prayer.
Yeah, there is a problem with the video.
Yeah,
I can, yeah,
yeah,
audio.
yeah,
is-
you can,
yeah.
yeah.
Yeah. Let us pray. Gracious Heavenly Father, thank you for this wonderful day. And God, thank you for Dr. Josna, the medical superintendent who initiated the program. God, Father, thank you for today speakers and panel doctors from different places, and bless them and bless their families and bless their hospital. God, Father, thanks to all the doctors for their valuable time spend this occasion. And thanks for that today webinar and occasional World Health Day. Through webinar, we blessed with a lot of information and we gain the knowledge. All glory to you, God. God bless all the participants and the families. And thanks for the Unique Office Health Foundation Board of Directors and Dr. team. We also praying for the Unicopus Polyclinic and the Unicopus Burdened Hospital staff members, and bless them and bless their families and grace upon them. And also we are praying for the Unicopus Health Foundation day-to-day activities, bless the work. In this time, we are on the pandemic COVID. We are praying for COVID patients and their families, touch them and heal them. God, once again, we are very grateful to your grace and blessing for today's program, and bless the whole team. And we are also praying for all the team and bless each and everyone. We ask in the name of Lord Jesus Christ. Amen.
Amen. Thank you very much, sir. So you can turn on your videos and say hello to each other.
Thank you, sir. Thank you, Dr. Samuel. Thank you, Lakshmi, sir. Thank you, Tarian, sir. Nice to meet you again.
Thank you. Thank you.
for
Thank
your
you.
valuable time.
Thank you so much from my side. Thank you, Jyotsna, for the things that you're doing. You looked a little anxious and nervous in the beginning, but you kind of you did a good job. It was very nice to see you, and then see the work I think Unicorpus is doing. We will definitely look for opportunities of collaborating in certain areas, which is of your need, which is also something that we are also learning. Not that we are an expert, but something that we can work on together. So we are open for any kind of collaborations and helping
sir.
each other. Right. So thank you once again. Thank you,
Thank you, sir.
for the work each one of you are doing. You will always be in our prayers, and we are always there anytime you need us. We will always pitch in to see whatever we can do.
Thank you, sir.
Thank you very much, sir. Thanks.
Thank you, sir.
Thank you. Thank you,
Yes, sir.
Josna, for
Thank you, sir.
inviting me. And this is very important. I also learned several things from other
Thank you, sir.
speakers, especially Samuel and
Dr. Sushi.
Sushil. So, thank you, Kavita.
Thank you, sir. Thank you for joining.
Thank
sir.
you. And especially Samuel, you have a very good lot of information. And if chance is there, I would also like to participate in your holistic medical textbook writing or any chapter on diet and other things.
I will take your contact from Dr. Jyotsna,
Yes, sir.
and anytime I'm visiting Hyderabad, I would love to visit
Definitely.
the NIN,
Sure.
because that's the
welcome.
mecca of nutrition for India. We do have our dietitians and all who have some training from there. So we would love to see if there's some collaborative studies and all that we can do.
Yes.
We'll be very much interested. So we'll look forward to touching base with you. Thank you so much.
Thank you.
Yeah.
Thank you, sir.
Thank you.
Thank you so much.
Thank you so much.
Thanks very much.
Thank you. Thank you,
Thank
Dr.
you, sir.
Jyotsna. Thank you so
Thank
much.
you.
Thank
See
you, Dr.
all.
Sushil,
Have a
also
good
meeting
night.
you.
Yeah.
Thank
Nice
you.
meeting you all.
And
Thank you, sir.
please do visit Unicorpus whenever you're in Hyderabad. We would love to host you. Please do come by. It'd be
Sure.
great.
Sir.
Sure.
So Lakshmi sir, I think you're in Hyderabad only, kada?
Yes, yes.
Yes,
ikkada
please
karanam,
come,
sir.
sir, sometime.
Yeah,
Either to our
definitely.
clinic or our hospital. It will
And
be great.
even all here Hyderabad medical college postgraduates, especially pediatrics and community medicine, they do this internship in NIN, 15 days
Sure.
internship. You can also welcome if your postgraduates are there, you can say.
Okay.
Sure, sir.
Yes, sir.
Thank you. Thank you so much.
Sure, sir.
Thank you. Good night, everyone. Have
Okay.
a nice
Thank you.
evening. Thank you, Kumar Virgaru. Thank you, Prabhudas, sir. Thank you so much.
Thank
Good
you, madam.
night.
Thank you. Thank you.
Thank
Good
you,
night.
sir. Thank you, Samuel, sir. Thank you.
Okay.
Thank you,
Thank
Sushil,
you.
sir.
Bye.
Thank you,
Thank
Jyotsna.
you.
Take care.
Thank you.
Good
Yes,
night.
sir. Good night, sir. Thank you so
Yeah.
much.
Yeah.